today is a very interesting topic. We're talking about Metaverse um, and the possibilities for healthcare and wellness. So we're going to discuss how it's going to look. We have a brilliant speaker with us today, and we'll be starting very soon.
Okay, so thanks Krishna for inviting me. Hi everyone, and welcome for participating in this new AITF alumni web series, where we talk about healthcare in Metaverse or Metaverse in healthcare. It doesn't matter. I'm Lucas Perez. I'm a strategic and medical expert, and I recently published a book entitled Real Health Virtual World, where I present this concept of the healthcare, sport, and wellness metaverse.
This webinar is sponsored by EIT Health Innovators Community. If you haven't heard about it, the EIT Health Innovators Community is a platform of all the healthcare entrepreneurs, everybody who's just interested or is part of the healthcare network and is interested in developing new solutions and new products and developing the new phase at the future healthcare systems. And through our network, through our community, we offer a range of benefits that you can see on the screen. You can take part in various webinars. We organize so many webinars of these. We have free tickets to some of the health summits in Europe. You can meet with experts and discuss your product challenges. And you can be a coach for alumni and so many other stuff. And also, you receive exclusive job and internship opportunities from EIT Health partners as well as other companies in the healthcare sector. And today, in this webinar, what we are offering you is a free pass to Viva Technology, Viva Tech Fest, that's being held in Paris from June 14 to 17. It's one of the Europe's largest and the biggest startup festival, where you can meet teams from small startups to big companies, big MNCs, various exhibitors, various players showcasing their products. And I think it's one of the brilliant conferences that you can attend, where you can see what's happening in the tech sector, what are the new upcoming innovations. You can talk to the people, the team directly, and especially for students, it's very helpful to find your next job, internship, or whatnot. And with this webinar, we are giving away 100 student passes away. So all you have to do after the end of this webinar is just send us a short email with your name and your student ID to community.events@ext.eith.eu, and we will give you the code to access your free pass.
Hi everyone, it's a big pleasure to be here today. Thanks Krishna for the presentation. I'm Lucas Perez, and I'm going to talk about healthcare in Metaverse or Metaverse in healthcare and all the services and the digital product we can find in this type of Metaverse. So now I'm going to talk about it, and I would like to precise that I'm not here to praise the Metaverse, say it's great, say it's a revolution, or it's super nice, super cool. No, I'm not here for that. I'm here to present the most realistic vision of what is the Metaverse, what are the benefits, but also what are the risks for user and patient by using this type of Metaverse. That's why I will share you 4 use cases about this new Metaverse, this emerging Metaverse, and I hope it will be useful for healthcare startups that want to integrate virtual reality into their businesses, but also for everyone, but also for academics who want to understand what are the challenges of this type of Metaverse. So as Krishna said, I released the book in December, and ironically, an unexpected result of writing a book about Metaverse is that I spend more time in the real world than the digital world. And even if there is a sort of hybridization between our human society, the real society, and virtual community, the virtual world, finally, especially in the gaming area, we can say that the Metaverse is no longer science fiction. And it tends to offer us an alternative universe in the digital world, one where we can live and be treated medically as needed. And in my opinion, this metaverse, the world metaverse, may not be a revolution. However, it takes us into the unknown regarding the technology, regarding the use case, and regarding the people who want to use this metaverse. And this book asks us, can we make health sustainable through a metaverse? And the answer is yes, we can. It might be the beginning of a new world where what we do physically could also be replicated, could also be done in a virtual reality world. So, and it's crazy. So, the definition of the metaverse. What's the metaverse? The metaverse is a virtual world that is a continuation of the real world that is more or less realistic. In this virtual world that everybody calls the metaverse, everyone is able to play sport, make friends, work, and also see a doctor in a 3D clinic or a 3D hospital. And since maybe 1 or 2 years, the concept of metaverse was becoming a buzzword. Everybody talk about the metaverse, the Facebook metaverse, Decentraland, the Sandbox, Roblox, all these metaverse. And believe me, I participated in a lot of events, workshops, and discussions where companies, but also the man on the street, have used the term metaverse. And everyone, believe me, everyone has their own representation of what is the metaverse, especially when it comes to the general metaverse. And in my opinion, such flagship projects in blockchain and crypto like Facebook, the Sandbox, or Decentraland have played an important role in shaping all this representation. So now the tricky question is how to access the metaverse. So first of all, there are many ways to access this large number of metaverse, because there are more than one metaverse. There's plenty. There's plenty of metaverses. There's plenty of ways to access it, to access them. And there are several metaverse for the general public. There are metaverse for the general public, like the Sandbox for virtual concerts, like for VR chat for social experience, or like Fortnite that everybody know, I'm sure, for video games. And there is an emerging metaverse, a niche metaverse to learn medicine, to talk to a doctor, or just for doing fitness program or fitness activities. Here's the current metaverse. So the current metaverse is the metaverse that everybody knows. And the best known way is the use of a VR headset to access this current metaverse. And this virtual reality headset allows user to step into an immersive 3-dimensional virtual world. It's a complete perception of our environment, and it's a new perspective that we don't have in a 2-dimensional environment. And this latest generation of so-called autonomous VR headset provide a greater ease of use. And it's interesting for the mass adoption of this type of technology, but also, to push this technology for the general public. However, and as you can see, the metaverse access isn't restricted, isn't limited to a VR headset. And you can access the metaverse just by using a smartphone, thanks to the augmented reality, the AR. So what's AR? AR is a virtual simulation in the world around us that inserts crazy images, that insert computer-generated images with the camera of your phone. And So you probably know the game Pokemon Go that popularized the concept in the general public. So imagine you are in the street and you have to find some crazy monsters, crazy Pokemon in the street, and so it's a sort of superposition between the real world and the virtual world, a superposition of images, a superposition of crazy effects, and there are also other technologies like hologram, like haptic technologies, for example, and haptic gloves, but I will talk about it just after, that could be used to access and feel the metaverse. And it could upset our current paradigm of what is the metaverse. And the question now is, how will it affect our current paradigm, and how could it affect the current metaverse? So this is the metaverse of senses, and it's a sort of the next gen of metaverse. This metaverse is deeply connected to haptic devices, replicating a human sense of touch, just replicating a human sense. And in this metaverse, you have the opportunity to relax, you have the opportunity to touch, to feel something with a great accuracy. And the mere use of a wearable haptic provides good sensation when you touch something in a virtual space, thanks to an haptic gloves, for example, and feeling cold or feeling hot is now possible to this haptic technology. And to give you an example, to give you a concrete example, this haptic technology can offer a high level of sensitivity, especially for healthcare, and could be a benefit for patient in rehabilitation, for example, after a car crash, after a car accident, for example, where the patient is suffering of a brain injury, for example, but also for everyone willing to understand the patient pain and difficulties. It could be useful for the HCPs, the healthcare professional, to better understand the disease, but also for the relatives also to support their children, to support their brother, and it could be very useful. So now, welcome to the healthcare, sport, and wellness metaverse. This is a new type of metaverse, as I say, and this metaverse is becoming an entry point from the real world to the virtual reality world, opening up a lot of new perspectives for the healthcare and wellness sector. And the notion of care, the notion of entertainment are not subject to the concept of time, location, or nationality. And for example, in a 3D hospital or 3D clinic, patients will get medical advice, speak to their doctor virtually, of course, and go through a medical procedure anytime, anywhere. But Metaverse is also the perfect place to relax, is the perfect place to get some wellness services by, for example, attending a relaxing session in the virtual world with a virtual healer, for example. But concretely, what kind of new products or new services can we get to see? And to present that, I have 4 use cases to present you. The first use cases is about simulation. In this metaverse, the healthcare metaverse, it will be possible to simulate a medical emergency. And it's crazy. So this idea came from an interview I had with Luke Julia, who's the co-creator of the virtual assistant of Apple, that is Siri. And now he's working for the French car manufacturer Renault, and he had decided to make car crash in the metaverse for many reasons, but the main reasons are ecological, economical, and ethical reasons. It's better to crash a person, a virtual person, a digital twin, a digital person, than a real person. And it's better to crash a virtual car than a real car, of course. So Metaverse could be a perfect way to simulate risk situation for the car industry, for example, or for an emergency in a nuclear power plant for the energy industry, for example. And on this line, for healthcare, you have a lot of opportunities for simulating, for example, emergency or virtual battlefield medicine in the metaverse in order to offer, for example, and I was talking about that with the French army a couple of days, to offer a very accurate version of a war-wounded man on the battlefield. And yes, it will be completely different than a standard mannequin, for example, because the standard mannequin could be used by, for example, doctors, but not especially for doctors specialized in war medicine. And this accuracy about the model, the digital model, is very precious for this type of application. And the doctor can practice on a digital twin while feeling the adrenaline of the situations, and it's the simulation, thanks to this immersive experience, thanks to this three-dimensional perception of the body. But let's be careful, because anything can replace the real situation or the real body of the patient. So here's the second use case. In the metaverse, you have a lot of opportunity for medical training experience, or to offer guide to the doctors. So as you know, it takes a lot of time to train a surgeon, to train a medical specialist. Approximately, it's 10 to 15 years for an orthopedic surgeon. That's why with this tech, we can, that's why this tech is promising to train faster a surgeon and let him learn better. AR and VR could significantly improve doctor performances according to different studies. And I was in a congress a few days later, and I heard that more than 2,000 studies and clinical studies was talking about virtual reality and medicine, and it's huge. It's huge. So there are different studies on orthopedic surgery, on dentistry, on ophthalmology, and they are all linked to the virtual reality. Virtual reality offers to the doctors a medical background, offers to the doctor a safe and an accessible complement to their medical training outside the operating room, because the room is becoming a three-dimensional room, and without involving a real patient. And it's what is important for this field. So you have a lot of applications, you have a lot of development for surgery, like for spine surgery, and you have a few companies that are working in this field, like for Virtualis Surge, that I met recently. And it's very promising for the medical learning to train the doctors. And we could also imagine a surgeon who's superimposing his hand in the hand of his confrere in order to help him, in order to interact with him during the intervention. And why it's something interesting? It's something interesting because there are the old doctors, and there are the younger doctors, and the older doctors can learn some techniques, some tricks to the younger doctors. And yes, it's a possible application of the superimposing into the metaverse of certain gestures, of certain techniques. So, what about the third use case? The metaverse is also for making additional revenue by selling NFT or a non-fungible token. So a non-fungible token or NFT is a unique title of property that can be purchased, sold, staked, or exchanged in the metaverse. And this notion of NFT means ownership. It means that anyone or any entity can buy or sell this digital asset, because NFT is a digital asset. Like, for example, the most known Bitcoin, because NFT is also based on a blockchain, this technology that stores the data, this technology that validate the accuracy of the information. And it's interesting. It's interesting for charity. It's interesting for philanthropy, because it can positively influence the metaverse by promoting the well-being of humankind. And yes, it's not an utopia, it's reality. And it exists an NFT philanthropy where different people could make a donation. For instance, a digital artist could have the choice to redistribute his proceeds for a charity, for example, for building an hospital in Africa, for helping children programs. It could be some example of what NFT could do for the charity sector. But big sport, the sport industry, sportswear brands seem very interesting in this use case. And the metaverse is for this industry, the sport or wellness industry, a huge opportunity, huge market for diversifying their activity. And this brand know very well that people always want more personalized features. They want real personalized features, but they also want virtual personalized features. And yes, they can sell some virtual goods, like, for example, shoes, clothes, virtual clothes, virtual equipments. And yes, and it's very lucrative for this type of actors, and for hospitals and for charity is non-lucrative. So it's two segments, it's two interesting way to use the power of metaverse and the power of the digital asset around the metaverse. So, and now to conclude about the use case, I would like to present you what I called a metaverse for wellness and social relationships. So this metaverse that I called in my book the Betterverse, a better metaverse, is very promising. And the question is, what does it mean to wellness industry and the social sector? And it means that there are a lot of possibility for the patient, for the user, and globally for vulnerable people, the vulnerable population. And I imagine a virtual world where a lot of non-medical products and services for wellness, for social applications are so marketed first. And it could be, for example, relaxing sessions for users, or healthy cooking workshop for ex-persons into the metaverse. And these offerings are very interesting for the company that want to create this solution, because the framework, the legal framework is very flexible, because we don't talk about medical services. We talk about non-medical services. We talk about wellness services, social services. And it's very interesting because these offerings are not sensitive regarding the personal health information that are processing. And there are also small actors that I've seen since 1-2 years in this market, and they could break out of the pack by creating, for example, NFT fitness programs for certain type of people all across the world, by using, for example, the reputation of famous influencers in order to gather a lot of users for doing fitness, for doing social activities, and on this line, Metaverse is for social relation, like Facebook is for social relation, and we are social beings with an appetite to communicate, with an appetite to build a friendship. Social relationships define an essential aspect of our social being, and ironically, building a sustainable metaverse without connecting people is like building strong relationship without meeting any people. And yes, it's ironic, but it's the reality. And that's why I think that Facebook and all the big tech company have become, over the years, a social fact, because they allow their users to share images, to share messages, to share social experience that that provide a specific service for these people. And the reason for the success of these giant tech companies is surely social interaction. So to conclude, I would like to make some recommendations for those who want to create a healthcare solution related to the metaverse. And I felt it was important to present some strategical use case in order to guide current and future entrepreneur in this new field. And obviously, there are still some unresolved issues and challenges. It's for sure. But my first recommendation is about user experience, which will be very important for accelerating the mass adoption of the metaverse, mass adoption for healthcare. And you have to keep in mind on the user experience, the UX experience for the user, for the patient, for vulnerable people, like for people with functional impairments. So wear an headset, for example, a VR headset should not be a barrier, especially when it comes to vulnerable people, for example. And it's also useful for the doctors to understand the disease, to understand the the functional impairments for this type of public. You have also to define your purpose. What is the appropriate metaverse regarding the needs of your user? Am I a patient? Am I an hospital director? Am I a simple user? And according to the need, you can create the appropriate metaverse. Is it a metaverse for entertainment? Is it a metaverse for a medical purpose? So yeah, define your purpose will be crucial to determine the type of your metaverse. And the third recommendation is very simple. So keep in mind that there are some risks regarding the metaverse in terms of security and privacy. And one of them is data theft and identity theft. Imagine that you are talking to the wrong doctor who is an hacker, or that your data is stolen by a private company or a criminal organization. And it will be very, very, very bad for your privacy, especially. And security protocols need to be updated and developed from the beginning by default, and not after the conception. You have to take into account this aspect in your development, in your software development. It's very important. The user consent about the privacy aspect is also very important for patients entering the metaverse, and it will be crucial to respect their privacy. And I want to conclude by saying that stay cautious about which type of personal information you decide to give and share into the metaverse as a user. So thank you for listening, and I remain at your disposal for any question. So thank you all.
Thank you, Lucas, for telling us a bit about the metaverse and the potential applications using some of our case studies. Now, before we dive into the questions, we would like for you to all fill a feedback survey to let us know how this talk was for you, and also give it some new topics that you want to hear about. We have a lot of new upcoming webinars that are planned out, which we'll talk about later after the Q&A section. But please take a minute and please fill out this feedback survey. This is very important for us because we get to know what are your interests, what are your topics that you would like to hear about, and how can we improve our webinars.
Okay, so thanks Krishna for the information. I will answer the questions. So unless I'm mistaken, the first question is from Beatrice. How can startups in the healthcare industry use Metaverse to revolutionize the way the solutions are delivered, used by patients? So what I want to do is that what I want to say is that this emerging market about the healthcare metaverse is very tiny. So to revolutionize this market, especially the healthcare market, you have to find the appropriate use case. And so what I see recently during a congress is that a lot of companies want to revolutionize, for example, the medicine by proposing a lot of VR solutions, but the market is very competitive. And in my opinion, it's not a revolution, because the products are very similar, and they propose similar things, similar product by using the VR. And so what I want to expose, what I want to present with this new concept of the healthcare sport and wellness metaverse is the fact that there is an entry point, and this metaverse is very large, and you have a lot of perspective by mixing, for example, medical solutions, by mixing wellness solutions, and I see the healthcare, these healthcare solutions as a whole, a global approach. We talk about integrative, holistic medicine or holistic solution, and I think that this type of solution will revolutionize the way their solution will be delivered and used by patients.
Talking about wellness, Lucas, there was one question that we received is, can wellness metaverse replace their antidepressants and can help people with anxiety and different conditions? So what do you think? What do you think? Is there a place for this? Can metaverse truly replace some of the existing solutions? How do you see it?
So it's very funny because we had this discussion with a guy from PricewaterhouseCoopers, because they are interested in this field: mental health, mental disorders, stress, anxiety, depression. And so in my opinion, it's a two-way sides. It's good, but it's bad. It's good because you offer a full immersive experience, for example, for people suffering from chronic stress, for example, or traumatic stress. And it's good because you make a diversion in their mind, and it's a good way for relaxing. It's a good antidepressant. But it's also bad because the people don't have social interaction with the reality. So yes, for me, it's not very good. It's not very bad, but it's a mix. Yes, it's a mix.
Okay, and now that the metaverse has been here for a few years already, and do you know of any existing healthcare solutions that are on the metaverse right now that one in public can use? Do you have any few examples or names that you can share?
Yes. So, full disclaimer: I'm not an advisor for this company, but in my book, I had an interview with a guy, Michael Kaldash, and he's the CEO of a company called Amedis. And Amedis, I think, creates the first healthcare NFT marketplace in a specific metaverse called Avalon. And so I think they are based in Dubai, but the two co-creators were from Amsterdam, I think, and they create this new metaverse for healthcare. And for example, they virtualized trauma centers, they virtualize rehabilitation centers, they virtualize a lot of things, a lot of goods. And so what I know is that they want to make some data valorization thanks to the blockchain. So because I precise that some metaverse are based on blockchain, like for the Sandbox, like for Decentraland, that the metaverse of Facebook, and other metaverse are not based on blockchain. For example, I don't know if you know this metaverse, Krishna, Roblox, for example. Roblox isn't based on blockchain. Fortnite also is not based on blockchain, and the old metaverse called Second Life isn't based on blockchain.
Okay, it's interesting to see, and I'm curious in general to see the different kind of solutions that can come addressing various health-related problems in our society. And we have one question in particular asking about solutions for air pollution related issues or any other environmental issues. Do you see such solutions coming up in metaverse markets in the future?
Yeah, so for air pollution, maybe it's a niche market. I don't know. But yes, so Metaverse is not the solution. Metaverse is a tool.
Yes.
Yes, and for air pollution, I don't know. I don't know that Metaverse is a relevant solution. I think that, for example, I know a company based in Lyon, in France, that working on a device to measure the air quality. And for me, this type of device that measuring, that assessing the air quality is more efficient than the metaverse. But the metaverse is maybe relevant for tracking, for monitoring all these data relating to air pollution. But I don't know that a day we live in the metaverse to escape
True.
this problem.
Indeed. We have one more last question. I think it's an important question on how can ethics be integrated in the metaverse? And especially now with the concerns around Facebook, Mark Zuckerberg, metaverse, and who controls the data and who is it being used by, how do we integrate ethics into it? And how would that look like?
It's a really good question because we are just at the beginning of this metaverse creation, and I think that ethics, the question of ethics, raise also the question of regulation. For example, so this giant tech company like Facebook, like Google, all these giant, so centralize the data. They centralize the data because their solutions aren't based on blockchain. And some metaverse, I think that smaller actors can push this ethical aspect into the metaverse by creating more ethical metaverse, like the Betterverse that I present in my book. So I think that ethics, so one aspect of ethics is the consent, it's also an aspect regarding the regulation, the GDPR, because we are all European. The concept of the user consent is very important. You have to require the user consent before to make an action, before to analyze the personal information of your user. So yes, the ethics is has to be conceived from the beginning, has to be conceived by default. The by default concept is very important. It's mentioned into the GDPR, and I think that this giant tech company, yes, are not on the line to make ethics for now, but for the future, I don't know.
The metaverse is still in a very beginning stages, and we can predict a lot of transformations to happen in that universe. And as accessibility to metaverse gets cheaper and easier, the governments will step in, the policymakers will step in to put in place proper regulations so your data is protected and what kind of services are provided in metaverse. And I think there's a whole new world to explore, and we can only hope for the best. And hopefully metaverse continues to provide value and actually be of useful value in the future very soon. So thank you, Lucas, for enlightening us with this topic today. We have several more interesting topics coming up in the next webinars. But before I talk about them, I want to remind you all once again of the free student passes that we are offering for Viva Technology Conference in Paris. So please send us an email with your student ID. And one of our upcoming webinars is about female leadership. We started this female leadership webinar series with a question asking, is female leadership better than male leadership? And over a period of 6 episodes, sixth episode is the final one, we have discussed various issues. And in this finale, we will be we'll be going a bit deeper into this question and address topics such as how to move from being a good expert to a good leader, what makes a good leader, and so on. And also, we also have an upcoming webinar about ChatGPT. Yes, that's right, ChatGPT, and then recently announced GPT-4, of how it is revolutionizing our day-to-day work, and how in particular healthcare experts and people within the healthcare industry are using this ChatGPT in their work. So we will be coming out with that webinar soon in April. And that was all from our side. If you have any more questions regarding Metaverse, so please feel free to reach out to Lucas on LinkedIn. Also, feel free to check out his book to read more about Metaverse. And that's all for now, and wish you all a very good day. Thank you.
Thank you all. Thanks.
Visit community.eithealth.eu to join our community and shape the healthcare landscape with us. For more such videos, subscribe to our channel.